Most people do not know what to do if they're with someone who knocks out a permanent tooth. Do you? Number 1, calm the patient. Number 2, find the tooth. Number 3, pick it up by the crown. That is the white part, not the long pointy yellow root, the white part. Do not touch the root. 4, if it is visibly dirty, like there are chunks of grass or dirt on it, then you're going to clean it off by holding that crown and dunking it gently in a cup with biologic media. I'm going to go into detail in a few seconds what that biologic media is, but it is not water. Do not put it in water, and don't you dare touch or scrub that root. Don't touch it. But if it is not visibly dirty, like you're like, oh, it fell on the floor, it's dirty bacteria. No, like visibly chunks. If it's got blood on it, little piece of bone, leave it alone. Leave it alone, and then look at me. Look at me. Here's what's next. The best prognosis for this tooth involves reimplantation. Yes, I need you to put it back in the hole. Just tap it in. Gentle, firm pressure like that. I know. The sooner you get it back in, the less swelling, the less of a blood clot resisting it going back in. And you're holding just the crown. Just that white part, not the root. The root will be pointy, but this is the fake one. Then you roll up a washcloth, a napkin or something, have them bite down. And then you get to the dentist ASAP. If you can't do this because you're worried you're going to faint, they're your mortal enemy, germs, blood, more teeth are going to be knocked out. Okay, then you need what I was talking about, the biologic media, because you're going to store it in that. And it's not water, never water, no water. You need milk, Hank's Balance salt solution. It's in something called Save-A-Tooth, which you can find on the Zon of AMS, and you can get it for your emergency kit. Or saline, not contact solution, but like legit saline, so that's hard to find. You're probably not going to have that. Or saliva, spit in a cup. Then run, don't walk to the dentist. Like get there soon, within an hour. You're gonna have the best chance of them getting that back in place. This is not true for baby teeth. Don't put those suckers back in, leave them out. Their time is done. But permanent teeth, even in adults. So young kids who have permanent teeth that get these knocked out, put them back in, but grown-ups too, put it back in. Your hope is that the cells called the periodontal ligament cells on the outside of that root, that's why you're not touching the root, leave it alone. But that root will hopefully reattach to the bone, and then all you need is a root canal for that tooth. The inner part, the nerve in that tooth died, but that tooth itself can still stay in place, look way more natural, much more easy in the long run for most people. If you get it in quickly, you can keep that tooth for the rest of your life. Now we gotta spread this message far and wide. Tag and share with teachers, nurses, coaches, parents, people who play basketball, soccer, hockey, all of those things without mouth. Rugby. Okay, how do you not put it back in backward? So in cross section, the tooth is somewhat triangular. The ones that are normally knocked out are these front 4 on the top or the bottom. And in cross section, can you see a little triangle like this? So the back of the triangle is the back, the side toward the palate or the tongue. Another way to think about it is the incisors are shovel shaped. And see how it's kind of concave? Wait, which way? Concave is in convex, concave. Is it concave? Did I pass 5th grade? I don't know. Okay, I'm back. I confirmed. It is concave. So the tongue side, the palatal side, the lingual side, whatever you want to call it, the side that's going to go inside toward the tongue is concave. It's caved in. The outer part that's more flat that you see goes toward the lip. So this is the tooth. If you find this on the floor, you're like, oh snap. And you look and you're like, okay, this side is caved in. A little bit more, that's the tongue side. You see where the hole is, you put it in. But legit, ER doctors, when there's multiple teeth missing from like motorcycle accidents, car accidents, they have put them in the wrong holes, they've put them backward, but they send them then to the dentist and it's been stored in biologic media, in the hole, in the mouth, so that's okay. We can take them out and move them and put them where they need to go. So as horrific as that sounds, it'll work still. Just get to your dentist ASAP. Every time I post this PSA about putting back a permanent tooth into the socket if it was knocked out, and I pretty much make all of you faint by being like, put it back like this, and you're like, ah! The inevitable next question to follow up is, does it hurt? And I just want to be like, y'all, it hurt like heck coming out. And then you think of like people in car accidents or mothers with adrenaline rushing who do amazing things like lift up cars to get their kid out from under them. Crazy stuff. Your adrenaline is going and then endorphins, all these things that are helping your body to overcome that pain response that was the most painful part, it coming out. If you get it in immediately before there's too much swelling and before a blood clot forms in that socket where it was taken out, if you get it right back in there, and there are people all in the comments, if you go look like cheer accident, car accident, my friend knocked their tooth tooth out, they put it right back in and it's stuck. So if you can get it right back in, then it will swell a little and then it will bleed a little in that little area surrounding the tooth. And that's actually going to lock it into place. So the sooner you can get it right back in, the better. It's really not going to hurt any more than it's already hurting. And it's probably going to hurt a little less just from the shock of everything, from endorphins and the adrenaline going. So sounds horrific, I know, but if you can imagine just in the chaos of everything, a tooth getting knocked out all of a sudden, you want to get right back in there. So if your bestie gets in a fight and his tooth is knocked out, really the best thing you can do is just pick it right up. As long as it's not dirty, shove it right back in there. You did him a world of good. Thanks. Best friends forever. Yup. It's true.
Okay, sorry. I had to leave that part in because I record these as placeholders for the questions, and that one was just so funny. But anyway, I'm actually going to comment a little bit more on this because it's amazing that people will have a car accident, a sports injury, and they put that tooth right back in. I do want people to understand that the tooth is not vital. So the inside of the tooth, the nerve, it's the pulp, so the blood supply and the nerve supply, that is severed. It's cut off. Unless that's a very young tooth with an open apex, that can't like reconnect and revascularize. It's dead. It's going to need a root canal. But the outside of the tooth, the periodontal ligament, that's what's around the root. That's why I don't want you to touch the root. Don't touch the root. And why you don't want to put it in water, because that'll kill those cells. That is what is going to reattach to the bone and keep that tooth in your mouth for the rest of your life. Because you can have a root canal but still have your natural tooth. And you can't even tell. Like the opening for a root canal is in the back of your tooth. So it can look very natural. Let me show you a diagram of a tooth, what I'm talking about. So right on here, that purple stuff, that is the periodontal ligament. And those are the cells that can, if still alive, and if you get it in within an hour, it's in a biologic media, or you put it right in, those cells can regrow and reconnect that little ligament and connect it back to the bone. You'll still have proprioception. That's the difference between an implant. You're still going to feel like you bite down and that flexes a little, it gives. And that's what a lot of people complain about having implants. One, it's really hard to match a single tooth to make it match the teeth around it if you have to have a prosthetic. You would much rather keep that tooth, and you're going to have proprioception still, which is pretty cool. So put it back in if you can. If you remember only one thing, put it back in.
Yes, and it's literally in my first aid kit. I'll show you guys some of the main things I have in there, but that's an important one. My husband is an ophthalmologist, so we are quite paranoid about injuries to the eyes and the teeth. So I'll show you what we have in our emergency kit, see if anything aligns. And if you're looking for where to find these things, now the clock app is like to a lot of things that we try to show you where to go, so you can screenshot this real fast. Numero uno, of course, being Save a Tooth. It's this little jar. It contains Hank's Balanced Salt Solution, and it's great. You just open it up, stick the tooth in, and run to the dentist. I give this every year to my kids' coaches, to their teachers, the school nurse. This is a great thing. Then for just generally cleaning wounds, got saline. You can use this just normal saline. The key for storing a tooth, rinsing a tooth, is that it is sterile and that it's isotonic. You're not using water, no water, and don't touch the root, okay? But this can work for cleaning wounds, and put it in a cup for tooth storage. Then Band-Aid, steri strips, obvi. And then I really like these. They're Micromend. They've got little like grippers to help close a wound. So I haven't had to use them, but I got them if I need them. Trauma shears, because I'm that paranoid. I also had this weird fear of my kids' hair getting stuck in the pool in the bottom. And so I wanted to be able to like quickly chop their hair off if they got stuck in the little drain at the bottom. And that was why these ended up in there. I also have Dermabond, which not everyone will be able to acquire, but my husband does. Because we had to glue her forehead while she was laying screaming on the countertop. We glued it shut. Rather than go to urgent care, we're like, we are two surgeons. We can do this. No, we did. Didn't score bad. I have a little pill crusher, and I keep Benadryl tablets in it just for allergic reaction, something like that. I have it on hand. And then this is a little cup. You can put some of that sterile saline solution in, have it press against their eye, and rinse their eye if they get like glitter or dirt in it. Anything I missed? What do you guys have in yours?